How you doing today, Miss Trimble?
Hello, I'm doing
Alright. How long has it been since we seen you last?
2 years.
Alright. As far as vital signs go, we checked your pulse oximetry a while ago, it was 100%. Fast forward 60 seconds, her heart rate's about 80. Respirations are around 18.
Just a minute. Just a minute.
Fast forward 60 seconds, apical pulse is 80, and it's regular with no irregularity and no tachycardia or bradycardia. Blood pressure is 106/64. Okay. Now, as far as your weight goes, 198 pounds was what the scale showed. 5'6" with an estimated BMI of 33. When did you have your last child?
About 14 months ago.
Okay. No temperature. Whenever we checked it, it was 98.6. Okay, so your skin and pigmentation is even and pink. You haven't had any areas of discoloration, no loss of circulation or anything like that that would make any of your extremities look different than.
No, I just have the redness on my arms.
Alright. Skin temperature's good. You look like you moisturize daily. That's great. Look like you moisturize daily. Okay, your scalp, have you had any dryness or irritation or anything like that?
No.
Smile for me. Well, your cheeks look like a fish. Okay, so that's checking your cranial nerve number 7, and there's no issues. Your temporal arteries. There you go. Okay, we don't have an ophthalmoscope to check your eyes, but looking at your conjunctiva, there's no irritation. It's the same bilaterally. Your sclera is white all the way across. The irises are bilateral color, no abnormal color anywhere. I'm going to check your pupils. They dilate bilaterally, and then whenever we do the indirect, once the left starts to dilate, the right follows. And once the right starts to dilate, the left follows, and it's about 3 millimeters. Each pupil dilates to about 3 millimeters or constricts to about 3 millimeters. Your external ears are okay. We don't have the otoscope to look inside and check the ear canal or the tympanic membrane, but you haven't had any hearing issues, have you?
No.
Okay. No tenderness to the ears?
No.
Alright. Back here. Repeat the words that you think you hear me say.
A, B, C. 3, 2, 1.
Alright. You only have to get 50% of those, and you got 100%, so the whisper test is passed. Let's see. Your nose, you haven't had any issues since you had the growth removed on the left nostril,
No.
right? Nothing's regrown in
No.
there.
No.
You have any sinus trouble?
A little bit, but I take daily medication for sinus
Okay.
problems.
Alright. As far as your mucosa on your lips, it's normal. Gums look good. It looks like you've been flossing. Open your mouth wide for me. Stick your tongue out. You had your tonsils removed when you were 5. We don't have tonsils, and the uvula looks okay. No issues with your tongue, no swelling. Can you move it from left to right? Up and down? Okay. And can you say it, laugh?
Laugh.
Say toad.
Toad.
And say deer.
Deer.
Alright, no issues. Neck is within defined limits. If I wanted to palpate cervical lymph nodes, I'd do the posterior ones back here, and I would do the superficial ones up here. I'm not good at that, so I do not know exactly where they are. If I was going to palpate the thyroid, it would be kind of in the mid-range of her throat here, and it would be around the trachea, just behind it.
We need to move positions.
Not yet. We don't need to move yet. No carotid bruise were heard. Whenever I listen to both sides, you can feel a strong pulse on each side, and you can hear a pulse, but there's no turbulence or any restriction of flow heard with the Bruit. Range of motion, if you can twist your neck back and forth. Okay. Is there time on there? Okay. Alright, chest and lungs. I'm going to listen to your lungs real quick. Deep breath. Okay. Percuss. Just checking to make sure that it's a normal resonance throughout and there's no dullness. And I would go down to the sides here. It's kind of hard to do with the shirt on, so I'm just demonstrating roughly the areas that you would do there. And then on the back, okay, so this is moving to the back of the patient. Then on the back, if the shirt was off, we did this the other day, so you would just percuss down, and I'm going to have you take a deep breath and blow it out and hold. Go down until the resonance changes, and then you would breathe in. So I'd mark right there, and I'd go down and mark right there, and that is the diaphragmatic excursion, and it measures 3 centimeters on her. And I did it on the left and the right side to check the diaphragm moving bilaterally. Respirations were 18, anywhere from 18 to 20 normally. Whenever, do some humming sounds. Okay, the vibrations are the same bilaterally. We percussed on the front already. Range of motion. Your upper extremities, raise your arms forward like this. Okay. And then you can stand up now. And go like this. And that's 50-degree angle, so that's good. No issues on each side. And then if we were going to do the epitrochlear nodes, they would be right in here. I cannot feel them, but this is where they would be in these regions if we were going to palpate them. Alright, you can sit back down. We're not going to do a breast exam, but if we were going to, we would just check and make sure there was no obvious lumps. To do the breast teaching, you lay supine and you go up and down each breast in an up and down motion, checking all the fields, and you use 3 different levels of intensity of pressure. You sit up and examine with your arms slightly raised in the areas of your inner arm. And then whenever you put your hands on your hips or lean forward, you want to examine in the mirror to make sure there's no visual lumps of tissue or any abnormalities there. Okay, now I'm going to stand on your right side, so if you could lay this way. Supine. You're going to be supine and I'm standing on your right side, so lay down that way with your feet this way. Okay. Yeah, your heart, if we were going to check the apical impulse, we'd be 4th intercostal space midline, and we would just look for a pulsation of the heart. There isn't hardly any on her, and there's no heave or anything like that. No, there's small pulsations, but no heave. And your heart beats around 80 beats per minute, and it's regular, and the only heart sounds I could hear was S1 and S2. There's no S3 or 4 and no murmurs. The abdomen is flat and symmetric and soft. The umbilicus is within normal limits. There's no hernias, and she does have pulsations from her aorta. As far as even light or deep palpation goes, I can't really feel any of her organs comfortably to where I know what they are. but I do feel her aorta. Whenever I do deep palpation, I can feel the pulsation of her aorta. If you were to do light percussion, you would hear the timpani sounds, and you would have a little bit of splenic dullness in this region right here, and typically it's around 7 centimeters. There is, for a femoral pulse, you would check in here, and hers are normal. All of her pulses are borderline strong. And if you wanted to feel inguinal nodes, you would also try to palpate in this region. Once again, I am unable to confidently palpate inguinal nodes. Both legs are the same size. Her right leg has a +2 popliteal pulse, and the left has the same. Her posterior tibials are also easily felt, and her pedal pulses are also. Now, as far as edema goes, there's no pitting edema, no swelling, no changes in color. Her cap refill down here in her toes is brisk on both sides. Alright, stand up now, or sit. Alright, so range of motion, you're able to bend at the waist forward. Alright, that's no issues. And can you extend your knee out 90 degrees? Do each one. Great. Do ankle pump. Stick your legs out and pump your ankles up and down both sides. Great. No sensation issues with the face or hands or arms or leg. No numbness, tingling. Close your eyes. What are you holding in your hand? Do left and right.
A mechanical pencil.
Okay. I'm just doing one hand at a time. Alright, now what are you holding?
Blood pressure cuff thing.
Okay. And as far as doing we would do the tendon reflexes, we would do the tricep one here, we would do the bicep reflex here, we would do the Achilles down below, the patellar would be the one that everybody does in the movies right here, and the brachioradialis you would do in this region. You would hit with the hammer here to check the reflex. The Babinski reflex on an adult should not be present. If it is, it can indicate abnormal signs happening in the body. It's only present in infants. Okay, and as far as musculoskeletal goes, can you stand up and can you walk across the room? Now when you come back to me, do heel to toe. Wasn't really heel to toe. Put your heel on your toes, like the drunk driver one.
Huh?
Like this, man. Like that heel to toe. There we go. Thank you. You haven't been drinking today, have you, ma'am?
No.
Oh my gosh. We're going to send you over to the psychiatric center. Now, walk on your heels. That would be designated like this. Okay. Now, stand with your feet right together like this. Close your eyes. Alright. Stay just like that. Alright, she's able to hold her balance with her eyes closed, so that's good.
Kind of hard.
It is, isn't it? Not done. Shallow knee bend. Just bend at the knees like this and come back up. Okay, now bend over and touch your toes. It's better than I can do. At the spine, she exhibited there that she's got 90-degree spinal flexion. Now bend backwards at the spine. 30 degrees. Okay, great. The only other things that we would have to talk about would be the genitalia, and I don't think we're not supposed to examine you, but you would examine for obviously external changes, if you would notice any growths, any lesions, if a woman would tell you about any problems with discharge or warts or anything like that, you would want to examine. And of course there's the cervical examination that you would do with the speculum and everything, but we're holding all that off for this particular examination. You haven't had any bloody stools or anything like that recently, have you? Obviously throughout the demonstration and assessment, I've been able to assess that she's alert and oriented ×4. All of her skin and complexion is normal throughout her whole body. Nutritional status is good to go. Posture and position, she sits erect normally. There's no grimacing, no problems holding certain poses. Mobility and gait were good. She has appropriate behavior and mood. There's no flat affect, and there's no abnormal laughing or any outbursts that you wouldn't think were normal for the situation. Her speech is well articulated. She was able to form the harder sounds with the tongue. And her hearing, she passed the whisper test, and hygiene is not an issue. Thank you for coming in today, Ms. Trimble. Have a great day.
Thank you.